to share with you what our vision is with Pallium, or where we want to go. I think this slide captures the key words and the key concepts of Pallium, and I'm sure you've had time to look through and read that. Probably the question that most of you have on your minds is, Pallium, why and how did it evolve? What is it all about? And so I want to spend the first few minutes just sharing with you where this came from. I think we're all very, very aware of the unmet needs of terminally ill patients, and that is why we do the work that we do. We also, most of us here are educators and understand and recognize the deficiencies in knowledge, skills, and competencies across the board. I think back to before I started palliative care, when I, in my medical school, received no training whatsoever in caring for the terminally ill. And I know I wasn't the only one. And I know still today there are many practicing nurses, physicians, pharmacists, and other healthcare professionals who have had no training, and yet in the course of their daily work have to, on occasion, care for the terminally ill. So we recognize that need. We also recognize more and more the limited education opportunities and expertise in rural areas. I guess my interest in rural areas stems from the 3 years that I spent in rural Manitoba as a rural physician, and prior to that in working on occasion in rural South Africa, particularly in an area called KwaZulu. And I know many of you have also done that. Rob Feinsing has spent a few years as well in rural practice. Many of us are family physicians as well, and so we come from a background of understanding, well, not fully, but I think having a feel for what it's like in rural practice and being a primary care practitioner. We also recognize the scarcity of the education resources as well as the clinical resources. If you look around the 3 provinces, with some exceptions, there are certainly in the urban areas, I think we're not doing too badly. There's still a lot of room to grow. But if you look at the smaller urban areas, you look at the rural towns, there's some pockets of expertise, such as in the Chinook Health region, which is why we asked Rob to be here with us, Bill and Nidik and Chantel, and 2 other health regions here in Alberta, Jackie Peden in the East Central, and Denny Heicher in the David Thompson Health region, where they're building up their programs. Unfortunately, both of them couldn't be here, but I've spoken to them and have a sense of their feelings on this issue. Then there's a lack of coordination of education. I'm sure many of you have been asked by a drug company to go out and do a 1-hour presentation or 2-hour presentation in a small town, and we're all doing these small little things all over the place. We're all doing educational programs, and I know I was speaking to someone not so long ago who was saying, I've got this wonderful program that I really want to do, but I don't have enough manpower, I don't have enough people to do it. So I think the best way to go is for us to come together and share that resource, and thereby being able to reach out to more people. I also feel that we need to be reaching across disciplines in our teaching. We work, and our model of care is an interdisciplinary one, where we work together to meet the needs, the various needs of our patients. And I think it's time we also, on occasion, learn together. I think during the course of the morning and the day, we're going to see that there's an imbalance in terms of the support of the stakeholders. We're out there trying to do our educational activities. The governments, particularly in Alberta, in Saskatchewan, in Manitoba, have come up with some statements about palliative care being important, but we don't see much flowing out of that. Some of us are fortunate in our local health authorities where there is commitment and where the money is being put in. We're not seeing a lot of it coming out to education, and particularly in rural areas, there are still many rural physicians and nurses who would love to take the opportunity of coming out to study further, but are hampered because of the lack of some monies. We've asked David Kay to be here with us today to give us his insights, and he's got a program that I think I wanted him to share with, and perhaps you'll see in terms of where we go to use that to perhaps leverage governments and governments within the various provinces to help out. what are the salient influences? We think of education, but I think we shouldn't forget the impact of all the other factors, political ones, administrative ones, that are important that we need to address as well while we're looking at education. Perceived versus real educational needs. We're doing these educational projects, and we're asking people, tell us what you want to hear, what you want to learn. But I think it's time we also stop and ask ourselves, what are the real needs versus the perceived needs? And then the lack of impact studies. How effective is it? Where, is that what we're doing working or not? Now, there are needs, but I think there are also opportunities. And I think we're at a very good and ripe time to jump in with a project like this. And so what are the opportunities? Well, there's a heightened awareness across the board of the need for palliative care. And it goes from our communities, from society, now asking, how are you guys doing in caring for those of us who are dying? There's a heightened awareness within universities, and you're seeing more and more palliative care entering into the curricula. There's a heightened awareness amongst health authorities. So I think there's a beginning of a momentum that we can take hold and be part of that onward movement. There's also the recognition of the power of partnerships. And I think about my Palcare EdNet project, that we did the online course and developed online information for patients and healthcare professionals. I wouldn't have done that if I hadn't got together instructional designers, educators, program developers. We all come here with different expertise, and I think we can pool that expertise and come out with something very powerful. There's some wonderful teaching materials and programs out there, which is why I brought in people like David Wiseman to speak about ERPIC, Frank Ferris to speak about EPIC. There's a wonderful book that Neil MacDonald has edited, the case manual. We all have some educational programs going on. This weekend we'll be doing a retreat in Banff. And I think it's time that we start looking around and start adopting, adapting, where need, developing new ones. But there's a lot of good stuff there that we can use, and we should stop reinventing the wheel. There's some wonderful interdisciplinary courses, and we'll hear from Deb Dudgeon and perhaps Michael about their interdisciplinary course out in Winnipeg that I think we could look at as a model for interdisciplinary teaching. There are fellowships and training programs. In Edmonton, the group has been very busy for the last few years training some rural physicians, and in Calgary we've started that as well. There's the retreat I spoke about, the clinical traineeship that Anna Tauber, for example, offers in Edmonton. There's some online activities, and we'll share later on the day 2 online courses. So those are the opportunities. What's also, I think, wonderful to see is within Alberta. I'm not so sure about the situation in Saskatchewan or Manitoba, but in Alberta, we're seeing a lot of the rural health regions beginning to develop palliative care programs. And they're turning to us and saying, please help us out with educational programs. There's new knowledge in continuing education. There's growing expertise in distance and distributed learning, and we'll hear some of that a bit later today. Accreditation needs. Family physicians and perhaps in the future nurses will be required to show that they're maintaining their proficiency, their skills. And this is an opportunity to jump in and say we can provide that. The retreat, for example, we're offering this weekend has just been granted 9 Main Pro C courses, credits, which I think is wonderful. So what's the process been until now? Well, after thinking about this idea, going it through, I realized that what we really needed was some guidance in terms of the process, guidance from professionals who have done this before, guidance from people who know the business aspects of it as well. And so I approached the Institute for Professional Development at the University of Alberta, and that's where Michael and Bert and Wayne got involved. And they've been key in drafting that initial proposal that all of you got to see, I think. And from there we went with our founding partners, yourselves, with that proposal, submitted it to the Rural Office of Health Canada, and we're fortunate in March to get the grant. So the grant is $250,000 from March 2001 to August 2002. And that brings us to the Startup Symposium today. So what the goals of the symposium today are to meet one another, to see who the partners are, the founding members, to share our experiences in doing the education, bring to the table programs that you have so we can have a look at them and see which are the ones that we can adapt, adopt, use, to see how we can support one another in our educational programs in our provinces and see if there's a room to collaborate across our provinces, and perhaps even in the future go beyond that. Also to collaborate with people outside. There's the Ian Anderson project. It's a pity Larry Libreck couldn't be here, but we've got a video and he'll be speaking to us about the Ian Anderson project. Collaborate with the EPIC project, with EPIC. I think there's a lot of opportunity here to look at people who've done some really innovative and excellent stuff elsewhere. Towards the end of the day, I hope that we were going to look at how we go to from here in terms of the process, what outcomes, what the next steps are, and the priorities that we should set. I've added this quickly as my thoughts, and I put there my thoughts, if I may, because I think we've got to value the fact that this is a collaborative effort. I'll share with you my ideas, but that's a working framework, and I'm sure some of them, will be dropped out. So my ideas is that we're going to use Pallium to leverage and advocate, to go to the powers that be and say, look, we need some funding here. We got money from this place. Now you guys must match with some money from over there. I've spoken about the adopting, adapting the existing programs and perhaps developing some if need be. Developing a menu of educational programs. So perhaps a menu of courses, a menu of an interdisciplinary course, week-long, perhaps some weekend courses, perhaps that can be used as well for evening courses in urban areas as well. Once a week, an evening a week. Educational activities targeting at a secondary level and at a primary level. Tertiary level being the tertiary palliative care programs, for example, in Winnipeg, in Saskatoon, Edmonton, and Calgary. But then designing programs to support people like Bill Inidick, Rob Waddell, those emerging local rural leaders. I envisage a basic palliative care course, a basic PAL care. We've heard of ATLS and ACLS, and I think it's time we come up with a basic palliative care, and also an advanced palliative care. And perhaps in the future, in these rural regions, they're going to say, to hire, you've got to have ACLS, which a lot of them are asking for now, but you also have to have some BPC. By the end of this, in terms of outcomes, we'll have an inventory of ready-to-use educational materials, that we don't have to sit down late nights, try and put cases together, try and get our objectives, our outcomes together, that we've all got that. Similar to what David Wiseman's done with his EPIRC. He's got some wonderful materials he's going to share with us. We've got to reach out, I think, to rural areas and not expect them to come into the urban areas. And I have this idea of a mobile education unit, perhaps a Ford Windstar. And every few weeks it drives out to a small town, and the people in the town will see Pallium, and on it will be written Pallium education for palliative care, etc. That in itself will be an educational opportunity. And perhaps in every town we go to on the Friday evening, we'll do a presentation to the community. Developing an online network, which I know Rob and Bill and Chantal have started working on. Some discussions online, keeping up to the best evidence, keeping up to the latest news in terms of the palliative care academia, and developing a network for that using the World Wide Web. Looking at distance courses as bridging technologies. And finally, the standards of, I think it's time we start setting standards for what is it to be a secondary consultant. And Frank Ferris and I were speaking about that last night, and I think this is crucial, that it's time we start saying, okay, if you're going to be a local consultant in your rural area, then what is the standard for the for your competencies? What are the standard competencies, the core competencies that you need to have? And I think it's time that we start advocating for that. And perhaps Pallium could be the seed for that. Standardized evaluation. I'm always running around trying to put together evaluation forms. And I think it's time we come up with a standardized one. And then some reference groups, for example, a group on the needs of the First Nations, a reference group or a workforce on introducing the technology, a workforce on evaluation. I'll hand you over now to Michael.
Basically, this is about a capacity building project in I think, a very innovative outreach initiative. We're going to try to do that just three ways, very simple, very elegant. Coordinate what we have, collaborate on what we have, collaborate on developing new if we need it, and communicating what the best evidence is, and creating a one-stop shop or a one window where people who are interested in palliative care education and CPD can go on the internet to find that information. So basically mapping resources, identifying and nurturing relationships across disciplines and sectors, and establishing the infrastructure to make this work. We think this is a new way of working together. We think that you think that too. Certainly we were very pleased with the enthusiasm we received late last summer and early last fall when we were putting this together. The basic assumption here is that if we're going to build capacity in the system, we're going to do that through the people, and that's the education and CPD thing. And we also believe that we can do it much better, much faster together than we can do it alone. And we think it's a responsible use to scarce resources, particularly as we get involved in more expensive distance education and distributed learning things where you have to lay out a lot more money up front. So what are we going to do? We're going to identify the needs. We're going to identify the barriers. We'll start that today. We're going to map existing resources. We're going to map other resources. And we're going to work together to identify the resources that need to be developed. And that's that.